Vanakkam, I am Dr. Chandrasekhar, Senior Cardiothoracic Surgeon, working at Sri Gokulam Specialty Hospital, Salem, Tamil Nadu. Today we will discuss about heart surgery. The most common heart surgery we perform day in, day out is coronary artery bypass surgery. These patients who have a heart pain and or a heart attack, they first go to the cardiologist who will diagnose the condition, and also they will undergo certain tests like echocardiography, ECG, and finally an angiogram is done to know how many blocks are there and what can be done, whether they can go ahead with stenting, or if more number of blocks, and if there are very complicated blocks, they send them for surgical correction. In surgery, what we do is we do a bypass graft. Where there is a block, we bypass that area. Now, the commonest graft that is used, bypass graft that is used, is saphenous vein from the legs. But unfortunately, the life of the saphenous vein is limited. It could be minimum of 5 years to maximum of 10-12 years. In very rare cases, it may remain patent, that means open for a longer period of 15 to 20 years. Especially when younger patients come to us, we have done and are doing what is called as total arterial revascularization. We use the internal memory artery, or called the internal thoracic artery, which is on either side of the breastbone. One of them, that is the left internal thoracic artery, is always used when we do a bypass surgery, because this has very proven long-term patency of 93 to 94% 10 years and 90% patency more than 15 years. So we take both the left and the right internal memory artery and do the bypasses by connecting those two, by making a Y or a T construction. Sometimes we also use the left radial artery. Left radial artery was used for a long time, long ago, but it went into disrepute because of failures. Today, with the availability of pharmaceutical agents like diltiazem, these arteries will remain patent for a very long time. They may not be as good as the internal memory artery, but they are the next best. There are two types of surgical procedures when we do a bypass grafting. One of them is off pump. That means we keep the heart beating, doing its work. The blood pressure and everything is maintained by the heart itself, and we operate by manipulating the heart into various positions and do the grafting on top of the heart. This is called off pump or beating heart bypass surgery. This is the most commonly employed method today. It has its own advantages, that we don't have to use a heart-lung machine, and heart-lung machine has its own deleterious effects. That means that when you put a patient on a heart-lung machine, the heart function of the heart and that of the lung is taken care of by the machine. So for that period of time, patient's life depends on that machine and the person who is operating that machine. And we will be stopping the heart, arresting the heart, and doing all the bypasses on the heart. Also, these patients who are elderly have diabetes, hypertension. When we put them on cardiopulmonary bypass, some of the organs like the kidneys and the lungs get affected. So their post-operative period is slightly prolonged. They also have a tendency for bleeding. More bleeding occurs because the cardiopulmonary bypass machine affects the coagulation system, the clotting system of the body. In today's world, heart surgery has become safe because of improvements in technology, in pharmaceutical agents, and also the number of people who are properly trained in India. There was a time when people from India, they used to travel abroad for cardiac surgery, but today people from various other countries like Gulf countries and neighboring nations, they are coming to India to get their bypass surgery done. Bypass surgery is become safe. If a patient comes with a good pumping of the heart and doesn't have various morbid conditions like a very bad diabetes, bad hypertension, obesity, and these things are not there, the chances of him not making is only 1%. 99% the patient will do well and go home. This will improve his quality of life for the next 10 to 15 years, even more, if he takes care of his diet and takes proper medications and alters his lifestyle. And also, it is not very expensive. Bypass surgery is affordable. Even an ordinary person, a farmer, an ordinary worker in the city can afford bypass surgery with the help of the state. Because it's being done in large number, the cost of surgery has definitely come down. So today's session is about coronary bypass surgery. I hope you have understood the various nuances of coronary bypass surgery, heart bypass surgery, and we will discuss other topics in the next session. Thank you very much.